All right.
Is there a way to change the name?
If you can. If you
Yeah,
can.
there
I'll
is.
just say I forgot my laptop and I have shared this.
Yeah.
Oh my God. Sometimes I think Ivan and I are too old for this show.
Oh. No. Okay, so then I'm gonna do this. Do this. I'm gonna do this.
76 shirt.
Yeah, he looks great.
Get his knee done, then we'll be fine again.
Okay, so you're on and
Okay.
I've put them side by side so you can see them.
Perfect.
Unfortunately, I don't have a mouse.
Nope,
so you
that's
have to
fine.
just do this.
Yeah, I can do that. And then I just, my mute button's up here.
Yep, yeah.
Perfect.
I can just
Again, where. Oh, we were there once.
Yeah.
So, yeah. So is the board. That's a great. Either ourselves. Goes. Go, yeah. Yeah, I should buy it up the street, just stay. Buy this.
Oh, Sheridan,
What'd you do?
I don't know what I did here. I got it. I went to take it off the mic.
Say something?
Hello?
I think they muted themselves.
Well,
Okay. Hi, can you hear me? It's Bonnie.
yeah, nice and clear, Bonnie, thank you.
Okay, that's great. Okay, all good. Thank you. Yeah, just don't, everything's good. Just
I might leave Rob's bag.
absolutely what did, yeah, whatever. That's great.
See.
No, all good. Now they're muted again, I guess.
They're muting themselves.
Okay. Alita, have you muted yourself? Hi, Katie.
I see you're in a hotel too.
Yes. All good, all good.
Anywhere you like. Well, then wait on this here because I'm gonna be good. I'm getting
Another 9 years.
Just listen to
Oh, yeah.
How are you? That's what happens. Take a garbage, I guess.
That's when you, well, so our well was broken, but all the first last thing. What happens when you're not?
Well, you must have a water on there. Yeah, you just gotta do it.
There's a lot of buckets.
Oh, Cecil. Fine, thank you. Nice to see you. Well, from a year ago, seeing every other, or just even a lot, not even last 6 months. Yeah. You haven't changed a lot.
You're looking magnanimous as normal. As magnanimous as normal.
Oh, yeah, well, thank you.
What's the church? No, it's not.
Depends on what day and what time.
Yeah, yeah.
It was one of the big movies. When we went into
No, I agree.
Yeah.
Yeah, I just talked about. Yes, yeah.
You see it. I have thought you.
Yeah. Everybody's friend all of a sudden.
That's what you
Good morning, everyone.
Morning.
Good morning, Dr. McKeechan.
Good morning.
Good to go. The owls there. Yeah, check. Is audio okay online? Good to go. All right.
Yes, yeah, I
Maria.
can hear you, Ron. It's Bonnie.
Let's give it full time because we've got a couple of members that are running a little late. Everybody forgets it's school bus season. School bus season and the construction season still continues on. I know I ran into a couple of issues on the way down.
You stop calling me a big truck. Just trying to be kind. Trying to make sure you get something. Yeah. One word. Oh, God. Yeah. 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 Yeah, I see. Like, okay.
Yeah, he's on.
Are you on?
Yeah. It's like every turn it's being reconfigured. Yeah. No. This seems to be a lot. Ready to go? All right. All right, it's 9 o'clock. I'm gonna call the meeting to order. I think this is the first time we've had a 9 a.m. meeting and you all look great, before the meeting. Shockingly, I'm not a morning person, but, I made, extra effort to, be up early enough, so I'm, you can understand what I'm talking about. Just advising the board that due to the website system change over today, for the new board, that we're unable to live stream the meeting. However, recording is going to be posted, post-meeting on the website. And audio is on so people can listen. Also do the branding event. We're going to try and aim to have the meeting over at 11 o'clock. I think, going through the agenda, I think we have a good chance to do that. If it has to go longer, then it will, obviously. And we'll just adjust the time to the branding event afterwards. So I just want to remind people that we're no longer using the old land acknowledgements as recommended by IHAC. Today I'm going to provide my personal reflections, but I would like to offer the opportunity for other members of the board to take that honor on at the beginning of future meetings. So if somebody could come forward today during the meeting or at some point to me and offer to do that for the next meeting, that would be wonderful. So I'll leave that out there for you. Let myself or Lita know that you will be honored to do that at the next October meeting. So with our land acknowledgement, we respectfully acknowledge that we gather on the Treaty 20 territory of Mississauga and Anishinaabe. For thousands of years, the Mississauga and other Indigenous people have cared for these land, waters, and the all living beings through sustainable harvesting, seasonal ceremonies, and stewardship practices that continue today. As the seasons change, we've seen over the last few weeks, and the land transforms, we honor their enduring relationship with this territory and commit ourselves to learning from and supporting Indigenous leadership and care for our earth. All right, so let's move to item 2, which is the declaration of conflict of interest. Are there any identified conflicts? At this point, seeing none. If any come up during the meeting, please let us know. We'll make the appropriate, take the appropriate actions at the time. Item 3 is the adoption of the agenda. Are there any amendments to the agenda? If not, motion to approve the agenda as circulated. Councillor Rial and Mayor Lobo. Any further discussion? All those in favor? And that's carried. Thank you. Adoption of the regular minutes. The minutes of June 18, circulated prior to the meeting. Are there any amendments? If not, I'll take a motion to approve the minutes as circulated.
Meet on.
Oh, sorry. Dr. Keisha first, Warden Clark second. Yeah. Yeah, you're first. Okay, you're moving in second. Any further discussion? All those in favor? That's carried. Thank you. There are no business arising from the minutes, and we're going to move to the item 6, medical officer health update. Dr. Figueroa.
Thank you, Chair. Good morning, board members. Thanks for being here today. Today's a big day. Excited about the activity, the launch that is happening afterwards, and really appreciate the work that has gone into that, especially from staff. But we'll save that for after our meeting. I have just a few updates today regarding a few developments. So the first is regarding the Alpha Symposium, which was held the 19th and 20th of June in Toronto. And myself and a number of members of our senior team attended that meeting. We circulated notes from that meeting, so I won't go into depth, but just to highlight a few things, I think it was good, good discussion, good conversation, good opportunity for collective conversation with the other 28 health units in the province and their boards and leadership. There were 4 resolutions tabled, as happens at the annual general meeting. 2 were passed, including one on addressing early years adversity and the resiliency framework into public health. There was also one passed regarding preventing heavy metal exposure from contaminated spices, cosmetic powders, and natural health products. So for natural health purposes. So those resolutions were passed. There were discussion and 2 resolutions were not passed. One was tabled for further engagement with the Alpha Board of Directors. So that'll come back. We had updates from Public Health Ontario. We had a strategy conversation and discussion around provincial contexts. And on the Friday, there was a meeting with the Board of Health section where they discussed a number of board-related issues. And with medical officers of health, there was a discussion with the Chief Medical Officer of Health, which I think was a really good conversation. Highlighting Dr. Moore highlighted a number of issues. Firstly, thanks for all the work responding to the measles cases that we've had. Really an unprecedented outbreak this year of measles in Ontario. He also highlighted continued work that needs to be done to improve confidence in the vaccine system and to improve uptake of vaccines, especially childhood vaccines where we've seen waning immunity, waning uptake of vaccines, and therefore significant public health risk. And we'll share a little bit more in the next board meeting, including a report that Dr. Moore has written, the annual CMOH report. And otherwise, I wanted to briefly say we were at the AMO conference. I was able to attend, and we had a delegation with the parliamentary assistant to the Minister of Health, MPP John Jordan. That was attended by Cecil and Ron and myself, and we also had a present from counties who requested the delegation. Warden Clark was there, and CAOs of both counties, Sheridan. So we, I think, had a good, we had a really good session and discussion. It was short. They always are short, but our framing was around the advocacy for sustainable public health funding and updates around the merger work that we've done to date. And I think there was a lot of interest, especially in the focus on how this could strengthen public health. I think the messaging around future funding needs and context was also received, and there was a desire for a follow-up meeting this fall, which we'll arrange down at Queen's Park. So I think that's also positive news. I'll let you add after if you want to add anything else from Emo. For myself, the only other 2 items that I just wanted to briefly mention are I circulated some correspondence, and board members may have seen discussion in the media around the Grey Bruce Health Unit and action taken by the province in relation to concerns on legislative compliance, governance, and financial related pieces. And so obviously thoughts with the teams there as they're working through hopefully improvements. And Jim Pine, who folks would know from AMO and municipal days, but also because he was a provincial consultant helping with the conversations after the modernization, the changes to public health that were proposed in 2019, has been appointed as a special advisor to support the Board of Health as they're going through a review and hopefully improvement. Lastly, we're starting into respiratory season, and we're looking forward to vaccination campaigns especially for COVID and flu and RSV vaccine. Dr. Bocking will provide an update at the October meeting about these vaccines and the broader context of our work around fall respiratory viruses. But one thing to highlight was the Minister of Health announced last week that the RSV vaccine, which is a very safe and effective vaccine, prevents potentially a lot of hospitalization, both in children and in pregnant people and older adults. The older adult version of the vaccine has now been expanded, where it was previously targeted at people in retirement home, long-term care, and with significant medical challenges. The expansions now decrease to anyone over the age of 75 is eligible for a publicly funded dose of the vaccine. So again, that's not an annual vaccine. We anticipate probably every 4 or 5 years that a booster would be needed, but that provides that vaccine provides good protection against a virus that is really a big hospital burden and big health burden for folks from a virus standpoint. And more from Dr. Bocking in the next week. And that's all I have, unless there's any questions. Thank you.
Thank you, Dr. Figgett. I'll just add a little bit on before we go to questions, just to summarize things. Alpha was a good meeting. First time I'd been to it. Mostly policy-driven type of conversation around the room. Not a lot of discussion around the need for sustainable funding for public health. In a follow-up meeting, we expressed that concern to Alpha, their CEO, and a number of other folks that were in the group. And if you noticed in the what's provided in the agenda package, their newsletter, one of their strategic directions is to talk about funding now with the ministry and spend more lobbying for that. They actually don't have a full-time lobbyist employed to do that for them, which was a bit of a surprise to me. But I think our comments and concerns have been brought forward to Alpha, that's got to be a part. Policy, public policy, health policy is obviously top of mind for those meetings, but without sustainable funding for public health, it doesn't matter. We can't do it without sustainable funding. So it's not reasonable to expect municipalities to continue to add more funds to support healthcare. Not their mandate. So maybe I thought that was a good step forward with Alpha this year. That there's a better understanding that funding has to be a key part of their strategic plan, as well as improving policy for public health. The other meeting that was I thought well done was their meeting with the minister at AMO. We had a great team there, and thanks to both Sheridan and Ashley put the cheat sheet together for us that we presented to them. It was very professionally done, very succinct, very much to the point, asking the province, number one, for another meeting and more of a one-on-one. As you know, these delegation meetings, for those that have been to them, you've got 15 minutes. It's really hard to get in. Well, you never get an answer, of course, from them, but the response, our request was for $3 million of additional dollars for base budget. We have a $5 million shortfall based on what we currently understand, based on the standards and the funding that we've been provided with. We've committed to find $2 million of that, and we're asking the province to top us up with $3 million on our base budget moving forward. So there wasn't a lot of eyebrows raised when we asked them. I think we've created a good relationship, that our merger is going well, and that we could certainly be an example to the minister moving forward to support future mergers of our kind. I think that was a key point that we wanted to make. We want to be that partner, but to be that partner, we can't have bad news 3-4 years down the road after the merger, when the base funding isn't 1% a year is not sustainable by any means. Municipalities are struggling with budgets as it is with infrastructure. So I came out of that with a very positive feeling that we're going to get another meeting with the minister direct. We'll have more time to actually sort of dig down into the numbers and come up with information that they can certainly lean on to make that decision. But I think they are interested in moving more mergers forward, and they need positive stories. And I think ours is a positive story and can be a positive story for them moving forward. So I thought that was a great show. I'll leave it at that and open it up to the floor. Councillor Ryle?
Yeah, just a quick note.
Deputy Chair.
I was at that delegation too, and it was like unbelievable. I mean, I've been part of a machine before, but not one like that. We executed in synergy like you would believe. And as both Ron and Thomas said they were very, very open and receptive to where we are. No promises, but at least we're. But my question is more related to the vaccine that we were talking about. Now, it's been reviewed at 75. Does that include or exclude people of a younger age that have, say, diabetes, COPD, something like that, or can they apply as a separate issue?
So the,
Through you, Chair.
through,
Yeah, through you, Chair.
so the province expanded criteria for all adults aged 75 and older, publicly funded. And it remains publicly funded for individuals aged 60 and over with certain high-risk medical conditions. So I don't believe that actually that the list of high-risk medical conditions includes diabetes. We have to go back and look specifically at the criteria. But the expansion was the general population aged 75 and older. The remaining high-risk groups at the younger age is the same as last year.
Thank you. Thank you, Dr. Brocking. Councilor Real, you have a question?
To the chair, I mean, can you clarify really what Alpha's role is? If they're not a lobbyist for the boards of health, then what is their job? I mean, you made a comment that they don't have a lobbyist at Queen's Park. So what really is their role? And that, you know, I've probably newsletters and all this stuff here, but I mean, I was assuming that that's their job, is to be a professional lobbyist for us, the boards of health.
I think typically, Councilor Real, organizations like that represent a number of different areas within. We have a larger scope than that, and as I said, my feeling coming out of the meeting was it was very policy driven, very focused on health issues and governance and that sort of thing. But most organizations like that would actually employ an external lobbyist funded to help them build those relationships with the Ministry of Health. I think they have a very good relationship with the Ministry of Health on the basis of moving policy forward, but not so much focus on moving funding forward. So that was my takeaway from it, and subsequent calls and meetings. I think they get that that's got to be part of the future meetings where there's discussion around funding. In the 2 days, everything I went to, the word funding was not mentioned in 2 days. So I think there's got to be a better balance, I guess is what I'm saying. And if it requires an external lobbyist to help with that, it's a skill set that if you don't have it in your organization, you're not going to get there, right? So we've encouraged them to consider that. We've also, as part of our merger budget, we have money in there for public relations. My plan and thoughts is we're going to move forward with our own consultant to try again for this $3 million to focus. And that person is going to help us with the ministry when we go to meet with them. I can't say who that is yet, but there is money in the budget for us to have those professionals come and help us get those additional funds that we need. I'm hoping that will help support it. But Alpha does not have a paid external lobbyist at this point. They get assistance from different groups and that to help them, but those of you who are in politics understand that it's more of an effort than that to get the money move forward. So,
I guess I don't mean to be negative, but squeaking wheel against the grease, and I don't see him. As far as I was concerned, that's what Elvis' job was, to be a lobbyist for us. I don't see that. I'm still questioning why we would pay them or belong to them. I'm seeing, sorry, we went through this process before at this board.
Yeah.
Why would we be paying somebody for, a newsletter and all the rest of this stuff? We need a professional lobbyist to lobby for us.
Yeah.
And certainly at the end of the day, when the amalgamation goes through, we're years down the road, when the rubber meets the road.
Yeah.
The government of the day is going to give you so much money and the rest is going to be on the municipalities.
Mm-hmm.
That's where we need a lobbyist to lobby for us.
Yeah. Or
the cost that's going to be for the municipalities to carry the board of health.
Mm-hmm. Again, I don't disagree with you with respect to their strategy with respect to funding. There was value in the meeting. There's no doubt about that to me. There was a lot of great conversation, a lot of good decisions made, a lot of good debate on issues. But again, for me, too focused on policy, not enough focused on, funding. And, I think the message has got to them. We've had a conversation around, lobbying, and that's what I said. I think we're going to, as a board, do our own lobbying because it will take some time for the Alpha members to agree to pay more, to hire a lobbyist to do that, and help with that. But, so I think it's short term, long term. Short term, we're going to do our own thing. We're going to advocate for that extra funding, that $3 million that we need. We're going to advocate for that ourselves. Trying to get the province to increase base funding for everybody, that's a mountain to climb in the long term. And focused on getting us the $3 million from the province in our base funding. That's what we focus on. We see any hands? Oh, sorry, Ward Clark. Yeah.
Yes, and through you, Chair. First of all, thank you, Ron. You've done a lot of work, and I think you've shaken Alpha up a bit, which is not a bad thing. So, you know, I appreciate that. I'm wondering if you ask them about their strat plan and maybe put those seeds and to try to drive this a bit forward to look to more of the financial support for them to do as well. I think we have to be at the table if we're going to make changes. Certainly the ministry does listen to Alpha. It's a back and forth, so we don't want to be excluded from that table. But I think there is some changes, and I think you can get that done. So I appreciate that.
Yeah, I think we have to be at the table if we want to make change, for sure. So,
Doctors, sorry, through you, Chair. So the 2024 to 2027 stuff, what Alpha is working from right now. So maybe it is just put the link in the chat if folks wanted to see that. It talks about being a unified voice, advisor in public health, advancing the work of local public health, support the sustainability of Ontario's public health system, and deliver member services to the public health leaders, all towards a stronger local public health.
yeah, and there are some points further in that presentation that talk about support for funding.
And if I may interrupt, you said sustainability, so that is lobbying for financial support to make us viable.
Yeah, absolutely. Thank you. Dr. Stelzer?
For you, Mr. Chair. You know, we've met with the ministry before. All the other units have met with the ministry. Alpha's met with the ministry. But in your private sort of or semi-private conversation, when you put the numbers down to them, what was their solution? When you said to them, we can't operate with 1%, and here's the reason why, we're 2 million short or 3 million, whatever. How would you approach the problem if you were in our shoes? Like, what can we do to satisfy the criteria? Do they have an answer to that?
Again, with delegations, you've got 15 minutes and they really don't respond to anything other than, again, our goal was to get the next meeting. Really, and that's
So
what
no answer, basically.
no answer at that point. And we really don't give them the detailed numbers at that point. Dr. Stelzer, it's more an overview. And so the two messages we wanted to put forward were, we're $5 million short. We're going to find 2 million. And but we need 3 million in our base. We need that to ensure that we can deliver services, that the merger does improve services as well. But without that, we're back to where we were before, basically, challenged to meet service delivery standards. And that, our merger is going well. I think compared to what I hear on some of the others, we could be the poster child for them on mergers, how mergers should work, how boards should work together, how communities should work together. And the $3 million is a rounding error in their health budget. So if they want to bring us around as an example, I think we could be that for them. But we have some skin in the game. We're going to find $2 million over the next 3 or 4 years. And but we need $3 million in base funding increase from them to maintain services and improve services moving forward. Without that, we're not necessarily going to be their best merger story.
Just as an additional comment, so would you think maybe the hesitancy to sort of give you some direction on how to act. Do you think they might think then is that a precedent for the other health units? Because I think they're almost all of them are short, some worse than us.
That's an excellent question. And that's why I think we're taking the strategy of taking care of ourselves at this point. We got to focus in on what our needs are, how we can come out of the merger a much better health unit together, and not have to slide backwards a few years down the road when funding becomes a big issue again for us. So that's a big hill to climb, and I think we will have a better chance of success focused on us at this point. I hate to be about us, but in this case, I'm going to be about us. But there's a bigger picture, obviously, and I think that's where Alpha has to do the legwork for everybody around base funding allocation increases each year. 1% is not sustainable, and loading more on municipalities is not a good answer. But it's really a two-pronged approach to me. Is Alpha needs to advocate for the bigger picture. Right now, we need to advocate for us over the next couple of years.
Thank you.
Councilor Chica.
Thank you, through you, Chair Black. I just wanted to say thank you to you, to Councillor Ryle, and just for being able to present that in such an effective way. They need to hear what our needs are. We're setting a precedent, and it just sounds like it was very positive. So look forward to hearing back from that second meeting, and the delegation was so successful. So thank you very much on behalf of all of us.
Thank you for the kind words, Councillor. Ward Clark, is that a new hand or a late hand?
No, just if through the chair, just to add a few more points. Hans, you're never going to get an answer in these delegations. They listen. What I was come out feeling positive about was the fact that John, I do know him fairly well. He certainly committed to a meeting this fall. He would never put anything out there without Minister Jones sitting at that table as an assistant. So I didn't expect that. I did meet him at some after hours events down there, and he told me they are quite aware of these shortfalls. So we are out of the same hymn book as a lot of others, but I like the approach. We take care of ourselves because they've got some amalgamations that aren't going down the right road, and they don't want everyone on the wrong road. So I think we've got a good chance at the province hearing us.
Thank you, Ward Clark. Councillor Ryan.
Yeah, just one of my point. The delegation was like I said, was synergy. To be honest, Ron and I were the opening act. I think Dr. Piggott and the staff report was the closer. I think that really drove the point home. My question though is more related to, are there any, to your knowledge, are there any health units that are not part of Alpha?
Yeah, currently no. There are all 29 health units are members of Alpha.
Thank you.
Yeah. All right, no further questions on that. Thank you, Dr. Pickett, for that report and some great conversations. So we'll go to item 7. Sorry.
Motion to receive.
Motion to receive the report. Yeah. Councilor Chica, Mayor Vogel, all those in favor? That's carried. Thank you. All right, that you up your great direction. All right, so 7.1 is a presentation on ice, heat, smoke, and drought by Julie Bromley today, and Julie's going to come up.
As Julie's making her way up, big thank you to the team for this thinking. I think what we were hoping was for a bit of a reflective presentation on this past summer, spring and summer, really. It was quite significant, and we know the public health role in supporting health adaptations to extreme weather events, climate change, emergency preparedness is really critical. So over you, Julie.
Yeah.
Thanks everybody for having me this morning. It's a pleasure to be here. So my name is Julie Bromley. and I am our manager for emergency services and healthy environments, which is still new to roll off the tongue. I was formerly our manager of environmental health. So I'm here today to discuss the healthiness work related to climate change and health in our region. And this year, there's certainly been no shortage of visible impacts of climate change. So, it's almost working, Sean. There we go. We have it all set up behind the scenes. That's great. This is a brief outline of what I plan to talk to today. We're going to keep it focused on the local context and the most recent work that the health unit is doing related to climate change adaptation. I would like to do a quick mention of the picture that you see up on the screen there. So I pulled over on County Road 507, which can be a challenge on its own for any of you who drive County Road 507. It was on a trip from the Haliburton office when I was driving back to Peterborough. I'm really familiar with County Road 507. It used to be one of my areas of inspection when I was a safe sewage public health inspector. But what a gorgeous picture, it was just such a beautiful day and it just looks like October colors there, except that was on August the 13th. And what really caught my attention driving down that road was just how stressed the trees were. You could see the impacts of the heat, the drought conditions, and everything else that we've been facing. And to me, it was like the trees were crying out for help. And that's sort of how I see a lot of the events that have happened this summer and this year as a whole. It's an environmental cry for help. So that's what we're going to talk to you a little bit about today. I'm going to start, however, with a bit of a story. So I want you to think back to July the 14th. What was interesting about that day is we woke up to rusty colored skies and the air smelling of smoke. We went to bed the night before with clean air and woke up hours later in a very high-risk situation. And that was because of the entry of wildfire smoke into our region. Those wildfires were burning in other parts of the province, causing our air quality to deteriorate significantly and rapidly. Prompted by the warnings issued by Environment and Climate Change Canada, and in accordance with our local response plans, we issued an air quality warning to community members and partners, urging residents to take action to protect themselves, especially those who are more vulnerable. So many people stayed indoors, sports games were canceled, practices were canceled or postponed. People with asthma, like myself, COPD, or other respiratory illnesses struggled to breathe. A lot of people felt the impacts just based on sore eyes, watery eyes, a scratchy throat. What about you? Think back, what did you experience? Your kids, your grandkids, friends, neighbors. It was a really challenging situation. And could it be worse? Yes. And it actually was, because we were also in the middle of an extended heat warning during that time. We had issued an extended heat warning on July 11th. It lasted to July 17th. So hot, humid weather coupled with smoky air is really a disaster waiting to happen. Luckily for our region, the significant air quality event was relatively short-lived. This slide shows the air quality health index during this event. And we have a monitoring station within our region that is in Peterborough. And for the rest of the region, we use two other stations. We use the Oshawa station to our west, which is the bottom right graph, and Belleville to our east. That's the top right graph. Coupled with real-time smoke mapping as well as wind direction, we're able to fairly accurately look at the risk for our region. Until more recently, air quality events have been pretty rare in the region. Historically, concentrations of fine particulate matter have been low, and the more significant concern was related to traffic pollution, not so much wildfire smoke. But more recently, the wildfire smoke has been the greater concern. And this year, the fires have been even closer to home, as you know, in our own region. So when you look at these graphs, the darker red colors are the very high risk, so 10 plus or 10, very poor air quality based on the index. Along the bottom is the time, and then along the vertical axis, that's actually the index. So you can see that there was a very, very drastic jump when the smoke entered from about 11 o'clock p.m. into midnight and then into the early hours of the morning, and then it decreased, the risk started to decrease throughout the day. So it's an example of how significant an event like this can actually be in our region. Oh. There we go. Sensitive about working off two computers, so. Another example of a wildfire that affected our region, but didn't cause an air quality impact, it had other impacts. It was the incredibly destructive fire in Sandy Lake First Nation, caused the evacuation of 2,000 community members. Peterborough was a host city for evacuees, and we welcomed 300 community members to our area. So locally, the impacts were more so to human resources and infrastructure demands. The Peterborough office of HKNP participated as a health systems partner, as well as a member of the City of Peterborough's incident management team. On the screen, the top image is just a reference of where Sandy Lake First Nation is. So the kind of view are here, up here by the Manitoba border, and then Peterborough's down here. So think of how far those community members had to travel for their evacuation. The bottom image is a picture of the Sandy Lake community during the evacuation themselves. Moving away from wildfire smoke and fires, we'll talk about something else that you've probably heard about. That's the expansion of the black-legged tick and Lyme disease. This year, Public Health Ontario has released a new portal, which gives us access to a lot more data at our fingertips. And they've also changed the risk area map to include the HKNP region. So it's all one, which is nice to see. What's not nice to see is the fact that the risk area continues to expand into our region. The yellow zones on the map show the established black-legged tick risk areas. And this is to be expected as we see increasing temperatures and our environment becomes more favorable for the black-legged tick. And our surveillance efforts, what we lovingly call tick dragging, you can see that in the picture to the right of the screen there, some staff doing some tick dragging. Those efforts help inform the risk area map. So we do tick dragging at sites in the spring and the fall. When black-legged ticks are identified both in the spring and the fall, that gets flagged as part of the risk area and the map is updated the following year. The bottom line is that we know ticks are here and we know our residents are getting Lyme disease. In our jurisdiction, there have been 75 human cases of Lyme disease as of August 3rd of this year. This is a rate of 20.45 cases per 100,000 population, which is almost 3 times higher than the provincial rate. It doesn't mean that everyone is acquiring the black-legged tick and Lyme disease in our region, but our residents are acquiring Lyme disease. It could also be travel related. But in legacy HKPR, Lyme disease has increased from 1 case in 2014 to 94 cases in 2024, and legacy PPH, 1 case in 2014 to 41 cases in 2024. As a local public health agency, as a minimum, we have to continue our surveillance and education regarding this potentially debilitating illness. We should be striving to do more, educate more, protect more, share more information, all in an effort to reduce the rate and the burden of this illness on our population. Okay, by a show of hands, anyone talk about how hot it was this summer on almost a daily basis with your neighbors, friends, whoever wants to talk about the weather, because that's what we do. But you're right, this summer it was a hot one. And it seems that almost each week we were issuing heat warnings or extended heat warnings. We've been fortunate that we haven't encountered a heat emergency, which would be a heat event coupled with something like a power outage, but the time is going to come. This slide shows actual data from the last 5 years for 2 key heat-related indicators. The top of the slide shows the number of hot days where the temperature was greater than or equal to 30 degrees Celsius for Peterborough, Haliburton, and Coburg. Just a note that we did pull the data for Lindsay as well. It was very similar to the Peterborough data, almost identical actually. Coburg, you can see, has fewer days that are very hot. So move to Coburg maybe if you don't like the heat. Why is that? That's the result of the lake effect. So the lake breeze that comes off and actually cools that region. So a cool little microclimate that happens there. But you can see in 2025 still more hot days even in Coburg. Just to note that the 2025 data is year to date up to August 14th, whereas the rest of the years are for the total year as a whole. So if I had pulled this data again before this presentation, that 2025 blue bar would be even longer. The lower half of the slide shows the number of days with the humidex greater than or equal to 40, which is another one of our indicators that we use. So you're really not alone if you're thinking that it was a very hot summer, and you're right. Our respective climate change and health vulnerability assessments showed projections of our region warming under every single climate scenario. The number of hot days is going to increase over the next few decades, and this is going to increase the health burden on our community, especially for those who are more at risk. We have an ever-growing population of older adults who will be significantly impacted, in addition to those who are unhoused or living without air conditioning or other sources of mechanical cooling. The impacts could actually be devastating. Think back to the heat dome in British Columbia in 2021 that unfortunately took the lives of more than 600 people. This is the reality that we face as a community and what is potentially to come. So far this year, our region has experienced a debilitating ice storm. Did you forget about that one? Feels like it was a long time ago, but it was a mere few months ago. Flood warnings, numerous extended heat waves, multiple days of hazardous air quality, local wildfires, and drought-like conditions. Climate change isn't a distant threat. It's here and it's happening now. So what's the silver lining to this? Because man, I'm full of good news this morning. More than ever, we need to continue and enhance the mandated work that we're doing related to climate change adaptation. What's really good news is that we can leverage the work that we've done to date through our respective climate change and health vulnerability assessments to continue to take strategic action that's going to help protect those who are most vulnerable in our community. Collaborating with community partners and continuing with local surveillance, we can work together to build community resilience. The climate crisis is a health crisis. Adding the health perspective makes climate change more personal and real. It can motivate action for both adaptation and mitigation. Each year, the conditions are becoming more unpredictable. Inaction is going to come at a higher price, paid in hospital admissions, infrastructure damage, and community suffering. Public health involvement in adaptation is not optional, it's survival. There is so much work that has been done by our legacy agencies over the last year, and I'm really pleased to share that we're already collaborating on so many initiatives, including our Indigenous community engagement work, our communications work, our education and outreach. We were just in the field yesterday doing some filming for a video project that we're working on, so some really exciting stuff happening. Our respective efforts for data and surveillance have positioned us to share information that are going to inform future actions around adaptation. We've done a lot of work preparing for heat, including establishing partner networks for enhanced community response, encouraging the operation of cooling centers and clean air spaces, rolling out heat health check-in tools, which was used in Peterborough by a local volunteer agency after we rolled it out. And using our tool, they were actually able to identify an individual who was in heat-related distress and get the supports in place that they needed. That may not have happened without that tool, so that's a great success story. During climate events, getting the information out fast and strategically through our distribution lists and existing networks, strength of our agency. Our information is used by others to inform their own decisions and activate their own plans. We're working to bring climate health risks into emergency planning and working closely with municipal partners so that our region is prepared before the next event hits. Another common thing that we have is that both legacy agencies have used the Rapid Risk Factor Surveillance System, or RUFIS, to gather information about beliefs and attitudes related to climate change. While many residents have experienced, believe in, and are concerned about climate change, the proportion of residents that think climate change will impact them in their own lifetime is fairly low. A higher proportion think that it will impact children in their lifetime. So we do still have work to do to demonstrate that climate change is a current problem, not just one for the future, especially when it comes to health impacts. Because ultimately, at the end of the day, every degree counts and every action matters. With everything that we are doing, there is hope. Those who are working on mitigation need to continue that work on the climate crisis, because that's going to help reduce the greenhouse gases, which is going to help mitigate the problem overall. Every response we have today as a public health agency has an impact. Public health adaptation protects our community members who are at greatest risk and prepares us all for whatever's going to come. Addressing climate change is one of the greatest public health opportunities of our time. I'm proud that this health unit has been a leader in working to keep our community safer, healthier, and ready for whatever is going to come next. So thank you for your ongoing commitment to this critical and life-saving work. I'm happy to take any questions.
Yeah, thank you, Julie. Appreciate the presentation. I think we're all aware of that. I have a question, but I'll go to the board first. Councillor Richardson and then Riel after that. Councillor Riel.
Thank you, and through you, Chair. Thank you very much for this presentation. I think Mother Nature probably threw everything it could possibly throw at us this last year. And I think it's so important when it comes to that education, communications, the early surveillance, and those warnings that we are issuing to the public. Just wondering, from a staff perspective, did it put a strain on resources because there were so many things happening at once, or just a continuum of different challenges? And when it comes to emergency preparedness, do we have just dedicated staff that are focusing on that just because of what we've just experienced this last year?
Yeah, thank you for the question. And it was a really challenging year, and it was one thing after the other, but that's one of the silver linings of the structure that we have. And hopefully a really important continuance is to have the dedicated staff available to respond to these situations. So we have, between speaking on both legacy organizations, they're structured slightly differently in that some of the emergency services staff do the response to like the heat alerts, the air quality alerts, whereas on the Peterborough side, we have some of our staff in the healthy environments team that are responding to those, so our climate change staff. So having under the new structure, having the emergency services and healthy environments is actually going to work really well, and that's going to complement each other. So having those dedicated staff work together helps with our capacity and can actually streamline a lot of the work so that we're finding efficiency, so we're not as overburdened. And because so much of the response is linked into municipal emergency services, that fit between healthy environments and emergency services is a really good one. So.
What a great answer. Merging the best of both services and into separate into one and improving services. That's fantastic. Yeah. Councillor Riel and then Councillor Joy.
Good Chair Julie, thank you very much for being here and making your presentation. I guess my question would probably be Thomas. I mean, Peterborough is a very caring community, and certainly we hosted the folks from Sandy Lake. What part of our budget is the money coming, because we had staff that helped out there, and would we be compensating by the provincial government for the amount of money that would either part of our budget, or are we going to be compensated for that, or is that part of our mandate?
Who wants to?
I'll start. Yeah, and Donna is here as well, who may want to add. I'll start by saying I think there needs to be some further clarification. We've had follow-up debriefings around roles and responsibilities. I'm proud of our team for leaning in and doing what we could to support. I think that was really important. I think we clearly do have some aspects of mandated work, because if there's challenges with infectious diseases, with folks, guests, friends in our region, because of access to vaccines or other equity challenges, that could impact other residents of the region. So clearly we do have some components of mandated work. I know that there is both provincial and federal funding around these kinds of issues. And in this context, there wasn't a lot of clarity around some of that. I think there was a process, Donna, for reimbursement. And I'm not sure whether that was exercised in the end. Yeah.
So I'm not sure if you're aware that Lumix Corporation was the host for the evacuation. And we could submit for reimbursement. There was a process, and it was utilized for some of the work, but as Dr. Piggott has said, a lot of the functions actually fall within our mandate. So the human resources that were deployed, we didn't seek reimbursement for them. Frankly, it was Hiawatha First Nation and that took on the bulk of the response within that from a primary care perspective. We supported them largely in those efforts. But we did have the opportunity to seek reimbursement for any materials and supplies. I'm not sure the status of that. It was shared with our finance manager, but it was through Lumix that we could seek compensate or reimbursement for the work. And I do believe that many of the other or supporting organizations did seek reimbursement. I'm not sure if this, even like the city Peterborough may have, I'm not sure. Yeah, there was a mechanism to be reimbursed.
And I'll just briefly add, we anticipate more of these kinds of events, tragically, sadly, and the need for being hosts, just like we'd expect if our community had to evacuate as well. And so I think debriefing and better planning into the future is critical, including clarity on resources. So we're working on that. We've escalated and had conversations with the province. Go ahead. Thank you.
Excuse me, thank you through the chairman, Commissioner Brown, great presentation, appreciated it. I have two questions and an observation. My question, they're related actually, is the air quality index stations. Seems to me is this a concern? It seems to me we have a gap north part of Kawartha Lakes, Haliburton, and within that, is that a concern? And within that, where would the closest station be to that area? Where maybe should we be looking at that as well?
Question. I think that there's sufficient stations that, coupled with the other tools that are out there, the wildfire smoke maps that are published by the Ministry of Natural Resources, as well as weather forecasting with respect to wind direction, that has worked for our needs to do the risk that we need to do and get the messaging of our community. Of course, I would always like to see more surveillance especially in our region. Unfortunately, we don't have much of an impact on where surveillance locations are. But through the Ministry of Health and specifically some of our environmental health meetings, we do have some of the other ministries come on to those, Ministry of Environment, Ministry of Natural Resources. There has not been a recent evaluation done of the air quality monitoring locations, but the focus recently has been on changing to include more monitoring for fine particulate matter, or PM 2.5, so that we have a better health index related to air quality events. So that was a win. Hopefully that they'll start looking at locations next time. The closest in the north, I'd have to go back to the mapping. Dorset. Thank you, Thomas, for pulling that up quickly. So Dorset, there is one in Dorset that we could look at as well. But I know in our current state conversations, the former manager for this said that they've historically used the Oshawa.
Right.
Yeah.
Okay, well, thank you. Yeah, and Leah, if we could turn to the PowerPoint presentation, the number of days with temperature graphs. Pull that up.
I think that's like 6.
I should have asked that first so you could pull it up while we could ask it, or is that some question? Yeah, so I just want to point out, okay. Okay, when you're looking at these graphs, folks, you have to comparing city to city with the blue lines at first glance, it might give you the impression that, for example, Haliburton is worse than Peterborough on number of temperature. But if you look at the number of days, Peterborough is worse than Haliburton. So right?
Yeah, so what you're trying to, this is the number of days, 20.
You gotta look at the number of days to compare city to city. Same thing down at Coburg, bottom right, there's 1 day, but it looks, at first glance, it looks as bad as Peterborough, which is really 6 days. So I'm just pointing that out when people were looking at that. Look at the number of days, like, for comparison from location to location.
If I may through your chair, that's an excellent observation. Thanks for bringing that forward. And I agree that that's one of the things when you're looking at data and displaying it like this, it can be tricky the intent of this one is really to show for each region, kind of look at it and look at the change over time. When
I
you see
captured
that.
that. Oh, yeah.
So, yeah, it's a really, really great observation because, to your point, we have a very large geographic region now and we're not all the same. And that's why kind of looking at those microclimates continue to be really important and adjusting responses to local needs as well. Thank you.
You're next.
I think so.
Sorry.
Were you, I think you were.
Yeah, you were.
Okay,
yeah.
okay. So thank you for what I saw of the presentation. And it's obviously such an important issue. I was really glad to see that there is such close interface between, say, upper tiers and lower tiers in terms of their plans, because what I observe is that two things. We've got climate action plans and they're mostly focused on resilience of assets as opposed to resilience of communities. And I think we need to change the narrative around that. And how do we do that? Well, first step is through education and awareness. And I, speaking for my community, there's huge resistance to our new climate action plan. People just don't think it's an issue. They don't think it's a priority. And all they see is that it's just another costly tax levy when we start to talk about building resilience in the community for unpredictable weather events. And we've really focused, the wedge in has been saying our buildings, our facilities, everything have to be ready and resilient for what we're going to be seeing over the next 10, 20, 30 years. Very little attention to the human health factor of it. So how can we work more in collaboration on the education piece, on the public awareness piece? Because truly, I don't think there's a really good understanding. And in many instances, there's just a complete backlash and resistance to it.
Through you, Chair, just to respond to your comment, thank you so much for recognizing that. And I think that's one of the messages I'm trying to convey here today is that we have an opportunity as a local public health agency to continue to bring the health plans forward. That's our role and that's our mandate for this, according to the provincial government, our Ontario Public Health Standards and Protocols. So that's what I would like to see forward. The more we can communicate that at the sort of individual community level, but then with community partners and with municipalities, we're going to build that community resiliency as a whole outside of the infrastructure and assets, right? Bringing that health lens forward, personalizes it and makes it real. You're not unique in your area for that. We are seeing that across the province. There's an Ontario Climate Public Health Climate Network, and that is one of the things that's talked about on that is the opportunity to bring the health lens in for climate change conversation.
So just as a follow-up, I'd really love it if you could start delegating to the lower tiers with a presentation that brings some of this information forward so that we can really amplify it through the community.
I would be honored to do that. We'll follow up. With Dr. Piggott and my director about that. And yeah, thank you.
Great, thank you. So next, I'm just trying to stay online here. We have Councilor Chica, then Councilor Royale, and then Dr. Makichan.
Thank you very much through you, Chair Black. Just so appreciating the conversation around the table and, certainly our hearts and minds were with our sister municipalities that were impacted by the extremes and the fire issue this summer. And I think, for those who are doubting and not on board, I think it rattled the cage and certainly just awakened and alerted folks to how great our vulnerability is. And I just wanted to share a couple of things. I have a friend and colleague with the Ministry of Natural Resources, and I often get things sent to me. And just this week, I got this sent to me regarding a municipal climate adaptation certificate for municipal leaders that is offered through the University of Waterloo. And it's also, it's in connection with the Canadian Network of Asset Managers. CM is providing this opportunity to help municipalities address the resource piece, as Councillor Richardson and Dr. Piggott were talking about how important it is to plan for future resources and financial planning in our municipalities so that we can be preemptive and invest And this is part of our budget and planning process. So I was just so impressed by this. And I can maybe share the link with Alita so that people can look at it. It's certainly something that appeals to me. I happen to hold the environment and climate change file, but you know, for each of us as municipal leaders, as we approach budget time and as we see our landscape changing and becoming more serious, it is something indeed we have to plan for. So it's exciting that FCM is providing this opportunity again through University of Waterloo, Green Municipal Fund, is for municipalities to take the opportunity to be part of the climate caucus, because best practices around municipal planning, a lot of that discussion is happening there. And I've been gleaning a lot from that as I go along, but wonderful to be together in this. And thank you for the presentation, because this data is so critical to getting our communities to be on board. So thank you, Julie.
Good, Councillor, excellent points, and we will go to Councillor Royale and then Dr. Peterborough after that.
My question is related to Lyme disease. We know that there are vaccinations available for animals for Lyme disease and so on and so forth. And I'm of the opinion that there's also one for humans, but it's never been released for 101 different reasons. God knows why. I think it's legal, but it's just not economically viable, perhaps. Is that true? And two, is there anything that can be done to encourage, or do we have to wait for the situation to get so bad that people are dying left and right?
That's three things, Dr. Pickett or Dr. Bakken, either one, I'm sure you know the answer to that. Thank you, Archie.
Yeah, I mean, just for the immunization components are not my area of expertise, so I.
We'll get back to you, Cecil. There's nothing authorized in Canada though.
No, I know that.
Yeah. But probably more important is prevalence increases, but we'll get back to you with kind of status and altogether.
Okay, thank you.
Thank you. Dr. Peterborough, go ahead.
Mr. Chair, this is a very good presentation. I think it's an eye opener for the board. I have a couple of suggestions for Julie. Number one, she should collaborate with Green Communities Canada as well as Peterborough Green Up. They are doing the similar work, and that will be beneficial to health unit. Secondly, there's a lot of funding available from both provincial as well federal Department of Environment. And thirdly, they can apply for getting a lot of money from the Trillium Foundation. This is a very interesting topic, and it concerns general public as a whole, not in Peterborough, is in the country itself. So we can do much better work if we try to collaborate and ask for funding from Trillium Foundation. Thank you.
Okay.
Great, yeah, through you, Chair. Thank you so much for that feedback and the information. We have actually applied for several grants just for the board's awareness. We were successful on one local grant that's actually helping with our local radio project. I will look further into the Trillium project.
Okay, thank you. Just a couple of quick questions. We're gonna shut this down. We've got lots to deal with. The tick numbers, are they separated by urban or rural? Because I think people feel it's a rural issue, not so much an urban issue. Do we know what the ratio is?
Yeah, great question. And I actually have an open ticket with our epidemiologist to look into the local data on the cases further so that we can explore exactly.
Yeah.
Yeah.
Okay, so I think that's a risk that people don't understand.
Yeah.
The other one had to do with the climate change portion of it with respect to risky human health. I live on a private road. There's 24 properties. When the ice storm came, there's about 6 of us that know how to use a chainsaw. It took the whole day to clear the road, that have access to those homes. And then 2 days of chipping, 6 of us chipping for 2 full days to get the debris off the road. One of the things that came out of municipal post ops on this is that that's a huge risk for fire, ambulance, police, and codes. If we had to wait for a private contractor to come in with everything that was happening over that period of time, it might have been 2 or 3 days before we would have anybody be able to get out of their property. So I think that's something, again, that the province has a team that goes around. It was a very small team. Very hard to get a hold of them that are there to help in those situations, but as everybody knows that lives rurally, the trees falling on roads, particularly private roads where it's very tight to begin with, there's no big shoulders and separation. So I think that's the take back to municipalities that came out of this one, is that they need to have a better understanding of how, from a safety and human safety health point of view, these roads have to be open to emergency vehicles at least as quickly as possible. So again, thank you. Then just one quick one then.
Very, just to follow up, not just the trees, but in our instance, we lost all communication to emergency services, which, you know, doesn't matter if there's a tree there or not, if you can't actually call. But back to the tick issue, I'm wondering if Dr. Bocking can provide us with any further information about data or some of the things that you're asking about.
So related to the vaccine, I think specifically there's some information on the CDC website. There's nothing authorized in Canada. There's not actually anything authorized in the United States, but there are some clinical trials that are underway. The previous there was a vaccine available like multiple decades ago, and then it was withdrawn from the market, and so it's back to looking at some new vaccines. So I don't think there's anything immediately in the channel. We're finding difficulties that we're going to see in the next couple of months, but there are some things that are getting closer.
Thank you. Thanks, Dr. Barney. All right, again, thanks for the presentation. I'll have a motion to receive the presentation for information. Councillor Richardson, Mr. Johnson, all those in favor, that's carried. Thank you very much. All right, we'll move to 7.2, which is merger update. So Dr. Fink is going to provide that along with Larry.
Yes,
So Larry's going to start.
turn right over to Larry. Yeah,
Okay, yeah.
thanks.
Okay, thank you for the opportunity to speak to you this morning. As we move through this merger process, we've been looking for ways to keep the board informed. What's the best way that we can allow you to provide your oversight responsibility, as well as to continue to be a champion for the organization itself and for the merger in your own communities. So clearly at this point in the merger, there's a lot of activity going on, and a lot of it is behind the scenes. So we do want to be able to streamline the reporting, so we're not taxing ourselves for our own reporting, trying to align where possible with other reporting requirements like the province, but again, making sure we provide the right amount of information to you. So at the outset, I want to say if there is something that's missing for you, something that you were hoping to know about that you're not hearing from us, or that the format that we're using could be improved in some way, we'd certainly like to hear that. We're still in the early stages of this. So what we provided in the agenda today was based on those principles, trying to provide the right amount of information for you and to make it streamlined. To start with, when you look at the dashboard that has been included, it indicates a number of the projects that are part of the merger and indicates the progress with those particular projects at this point in time. So first I want to note this is actually a tool that was created by the ministry, and it was intended to reflect all of the 4 mergers that are going on in the province and some common projects that all of them would be doing. And the timing, the sequence where they put them, which quarter they put them in, was where, again, the most common place was for different merging health units would provide. So I want to point out, first of all, that it wasn't created specifically for our merger. And secondly, that that we don't necessarily include everything in this, all the projects that we have going on. There are other pieces to our merger. So that's why we wanted to include the second piece of our report. So we created a narrative to go along with this. And the narrative can provide more information than just whether something is in progress. But it can also include other projects that may not be listed in the dashboard. So we're trying to make sure we bring forward information in a timely way across all the different projects. So with that in mind, I don't want to go through all the items in the dashboard or even all the items in the narrative. I know you've taken time to review that, but I do just want to highlight a few things to talk about some of our successes. The first one that's flagged in there in the report, as well as the dashboard, is our liability insurance coverage. So as in all areas of our work, we've tried to look at what each of the legacy organizations have done in the past and maybe what other organizations outside of our own health unit have been doing and what we could do to find the best future state for ourselves. Where we landed with all of this is to be insured under HIROC, which is the Health Insurance Reciprocal of Canada. And they not only provided the best rate for us and the significant savings over the two combined rates of the past, but it also provides many other services. They provide educational opportunities to reduce risk, especially around the cybersecurity piece of things. They also provide very healthcare specific information, both in their newsletter and online resources that we have full access to. So it's an additional way that we can continue to reduce our risk and keep our premiums down. The second one I wanted to mention was that we have started this work on assessment of facilities. And that sounds like a very short term, but it's a very big initiative as part of this merger. Really what we want to do in this first phase is to understand our current state. So how do we use the facilities we have? What are the current needs that may not be met now with the facilities and equipment that we have? What do we anticipate the future demands of programs to be, and what do we need from a facilities perspective to support that? So we need a good understanding of that before we can begin to plan where do we go in terms of renovations or in terms of even potentially new builds. And that piece of the puzzle will be a big piece of our work. It's important that we do that quickly because we do have this window of opportunity. If, for clarity, the merger funds itself are not likely to be going towards our capital needs. Small renovation projects can come from the merger funding, but what they're really doing is saying the capital branch for the Ministry of Health will provide that, they provide on an ongoing basis money for funds for builds and renovations, but they were prioritizing merging health units at this time. So we need to get on that list now. Even if the work doesn't begin during the time of this merger, we need to get prioritized and approved for those projects. The third thing I will mention is IT. It's, again, something that is much behind the scenes, but it is a lot of work. And really want to commend the team that's involved in all of this work because of how they've approached it. Having collaborated or talked to other health units about their work on IT, there's a whole range of how it's being implemented. As sort of referenced earlier by Ron and Thomas, I think the way we've approached it is a very strong one, and I think we'll end up with a good result in the end. The most important thing that's flagged here is that by the end of this year, we'll all be on a common platform and all be using the same tools. And that is an important, really important first step. It doesn't mean all of our IT work will be done. There will be more that will follow after that to improve and set up our new system for managing the services of technology across the new organization. But really important first step this fall. The last thing I want to highlight is the transformation team itself. So the team right now is, aside from myself, is the project manager, Carolyn Doris, Sarah Gill, who is leading change management and communications for the merger. And then Liz is supporting us as an executive assistant. We also have two additional postings that we have right now that we're in the process of filling to support this work. But most importantly, the merger work is across the organization. We're just the support team. I'm really proud of the work our team is doing, but the key thing is how we can leverage everyone across the organization to bring the right information forward at the right time and lead us to that future state that's going to lead to better services and programs. So again, we're learning as we go through the process because none of us have done this before, and anyone who's been through the merger, the other health units will always say, every merger is unique. So we are trying to figure out the best way forward for ourselves, and we'll continue to do that as we move into what I will say is the second half of the 3 years that we're in.
Thank you, Larry. Thank you for that presentation and update. Questions from members of the board?
Just going back to the capital and facilities assessment, I know that you said that it needs to get done as quickly as possible. And so what are the specific timelines around determining what those needs are going to be in terms of potential new builds of facilities?
So we are proposing right now, the needs assessment will be done this fall. And that will give us something to come back with recommendations to Thomas as CEO and where necessary to the board if it's a more significant initiative like new build.
Councilor Al and then Mayor Lowell.
Would you be able to say that we would have some kind of report, say by the end of the first quarter of 26, to give us an idea of where we're going?
Oh, absolutely. Yeah.
Thank you.
Thank you, Chair. Larry, question is basically the same for IT because I believe IT is so important. So where are we now and what is our goal to, what timeline are you looking for that as well?
So again, by the end of this year, we're integrating the two systems. So we're creating a common platform for us all to operate from. The other thing that will happen later this year is moving towards an RFP for a managed service provider. As was reported in the initial assessment, the IT has been managed very different ways by the two legacy organizations, one with almost all being contracted out, one with almost all being in-house. And the strong recommendation from the consultant at that time was moving towards a more hybrid arrangement. So we need to have some in-house, but we should be contracting out as well, especially for things like 24/7 coverage. So those things will be in place for 2026 as we start a new path forward. But that will lead to some other builds that will need to happen. But I think we are very confident, but by the end of 2026, we will have in place what we need in terms of systems for going forward.
Sure.
Councilor
The only reason that I brought up the end of the first quarter, because that's the end of our first quarter, but it would be the beginning of the third year.
Yes.
Of merger funding. So it'd be kind of nice to be able to put as much of that, if it could be done, into the merger for year 3.
Exactly. And that's why, again, we're moving towards recommendation by the end of this year. So first quarter would be the last of next year would be the last. Okay, I'm not very fine with it.
Thank you to you, Chair. And I know time's precious, so I'm going to talk back. It's not a question. I got to get it off my chest. My side business, I run a conference this happens to have a cybersecurity component. By no means a cybersecurity expert, but I kind of wish I didn't know what I know. It's just an emphasis on, what keeps me up at night? It's getting hacked. I know you're probably doing everything you need to do, but it's just can't emphasize enough for how much we have to protect our IT infrastructure from that. It's running that conference. I just hear these horror stories. It's just really scary. Thanks for that.
great comment. I think we're on it, but you never know these days. Dr. Stelter.
Thank you to you, Mr. Chair. Just a comment when you were talking about insurance, again, something I need to get off my chest. So given that we're in a merger situation, the legacy boards, two legacy boards, a merging board, a new board, what insurance, are there any changes in our insurance procurements that cover board members?
There's always insurance for the board as part of the package. And has that changed to increase the coverage or change the coverage? Not at this time, no. Like it's fairly common sort of amounts of limits that are set for that piece of the policy. So if there is some more information needed from the board on that, I'm happy to bring that back.
I'm just thinking, at this stage, there's a lot of room for mistakes where somebody could look back and say, well, if the merger board had only done this, then we wouldn't be in this situation. You know what I mean? I'm just trying to make sure that as we sit here, that we're still all adequately covered.
That's a great
Happy to
question.
bring something back, and I know there have been presentations at Alpha in the past by their legal support on board liability. There may be some online pieces from Alpha that we can share with the board as well.
Yeah, I think, thank you, great question, thanks for the response, Larry. I think I think everybody's noticed in organizations, they're upping the limits, constantly on those things, so just, maybe a brief on where we stand with respect to the whole industry and our peers in that situation, so thank you. Any, other questions? All right, I'm gonna entertain a motion to receive, Larry's update for, migration. Set of hands here. Dr. Makicha moves it. Any seconder? Dr. Stelzer seconds it. Any further discussion? All those in favor? That's carried. Thank you. All right. So now we're going to the merger. Oh, sorry. No, I'm moving on to 7.3. So Stewardship Committee report. There's been a lot of information circulated for this meeting around the harmonization funding piece. A lot of great discussion in the June meeting, at the July meeting. The recommendation that came out of that was 2B that was circulated. And just to give you an understanding of kind of the discussion, that's Larry to add and Cecil to add certainly as well. The 5-year harmonization period under 2B. So originally there was a 2, and everybody said, yeah, 2 makes sense. And then there was some discussion around, well, what if we front loaded more of the mitigation funding in the first 2 years that are left in the 3-year merger? So what would happen to 2, call it 2B, if we front loaded more of it there and less of it in year 3, 4, and 5? That mitigation funding in 2B is $1,062,000 of mitigation funding would be provided to the legacy PPH providers, because this is not in addition to the normal budget increase that would happen. So under 2B, that increases taxation for legacy Peterborough PPH funded by $6 million over that 5 years. So it spreads it out over 5 years, roughly $1.2 million a year, a little more front end loaded. So with that, and that includes the mitigation funding that would be provided to those funders to help cover part of those costs the first 2 years. So, but the net amount is still $6 million more over the 5 years for those loans. If we went to the 1-year harmonization, which is 2D, again, the question came up again after the front end loading question was, what if we did it all in 2 years or we did it all in 1 year? Kind of came up. What would that impact be over 5 years for the Peterborough funders at this point, legacy Peterborough funders? So doing the 1-year harmonization, it would add $11 million over that 5-year period, and then forever, of course, for Peterborough funders to bring per capita funding similar. So I think the recommendation was maintained that the 2B, which is a bit of a front end load, gets us there a little bit quicker from a total dollar perspective, but still a reasonable and fair approach for the additional funds that the legacy PPH funders are going to have to provide on top of the budget. So the 5% that was then in those Excel spreadsheets, it was just a placeholder. This is not about our budget at this point. This is about providing staff with a roadmap on how we're going to get there with respect to just the harmonization of the per capita funding. So that 5 could be 3, that could be 6. That's a budget issue that we're going to be discussing later in the month, stewardship, and bringing that forward to the board in October. So, I think we all understand why there's a difference in the per capita at this point. 2 slightly different business models, clearly, cost for building locations and that sort of thing was a big factor. Union settlements were different. Insurance was different. IT, as Larry spoke to, those are all things that were done differently. They created different costs for the legacy HKPR and PPH. So I think 2B gets us, and I think it's still a very onerous increase on the legacy Peterborough funders, clearly. But I think the funders in Peterborough knew this was an outcome of the merger, that at some point we need to get to per capita, funding. But I think, we as a board, the legacy board, felt that the merger was the most important thing to improve services to the region. And we were prepared to add some additional funds, to make that work, for everybody. So, I'm gonna leave it at that. Trying to explain the history of how we ended up with 2B and 2C and 2D. 2C and 2D were kind of after the meeting requests for information. We weren't really discussed at the meeting. Again, the recommendation was to go to 2B. Larry, I know I probably stole some of your thunder there a little bit, but, if you can go first and then Cecil, I'll let you drive it from there. Sure. Yeah.
I don't have a lot to add. Through you, Chair, the principles that we started just with were basically to align the per capita funding. We were going to move to the higher level, that we would make sure that there's adequate funding for public health services going forward, which means the legacy PPH funders would have to move up to the level that was being paid per capita. So we also talked about the fact that it should be a phased approach to mitigate the impact that it would have on municipalities. And we also talked about optimizing the merger funding, because for the period up until April of 2027, we can use merger funding to mitigate the impact on municipalities. So initially, the request to staff was to look at a 3, 5, and 8-year scenario, as Ron described, and that was reviewed. The 5-year one being the number 2 was where there was the strongest interest, but that led to the discussion about, well, could we optimize the use of the merger funding? So that's, if you look at the actual document, it's 35% in each of the first 2 years, and then 10% in the last 3 years for the overall increase, how that's attributed. So that's what's being presented as the recommendation from stewardship. The additional information that was requested was to say, well, if we really wanted to optimize using the merger funding, and have all of that mitigation, that $1.4 million, that could happen in either 1 year or 2 years. After that, you don't have access to merger funding. So that's why those pieces of information were shared. And we are hopeful that we can have a decision so that the staff can move forward with planning. If there's a decision today, we will be able to come back in October with a proposed budget. And there has been requests from municipalities for us to provide information regarding levies before November. So that's why we had suggested moving the budget approval back to October.
Thanks, Larry. Just again, Larry's talk had a couple of numbers there. So when you're looking again at the difference of the utilization of the merger money, we're utilizing $1,062,000 with the 2B. That only increases to 1.427, so less than $300,000 difference. Yet the taxation spend by PPH funders would increase by $5 million. So there's no value in adding more merger beyond a certain point in the math, right? So, and I think that's where 2B kind of struck us in the middle on this thing. That was the 70%, 10 and 10 and 10. So thank you, just for clarification, Cecil.
Yeah, I think the big problem that we had when we first looked at this harmonization, when we first got started, before we got the 1% cap, and we got a whole bunch of other costs that we hadn't anticipated at that particular point in time. We honestly felt that there might have been a reduction in what the legacy HKPR people were going to pay, and since then we found out that just isn't going to happen. We're all going to get increases one way or the other. So if you look at the 3 scenarios that you'll see that the legacy HKPR people, their numbers don't change at all. It is what it is based on the 5%. That would be adjusted based on whatever it would be. So the actual impact is mostly on the legacy PPH people. And so it becomes a question now of how do we go about making sure, one, we take best advantage of the merger money that we can, and at the same time, not put as much pain into the overall graduation from where PPH is at the moment to where it needs to be in 5 years from now. So there needs to be some compassion on the part of the entire board to recognize that if we were to do that in 1 year without any funding, I'm not sure if both Peterborough and city and county could tolerate the overall change. It would just be astronomical, and I don't think any of us could handle that kind of a deal. Hence, we got to the 2, which is where we are now, recommending a 5-year period. And in that 5-year period, 2B, which is to take advantage of it. Now, what it's going to do is it's going to force discipline on the part of the Peterborough City and Peterborough County, because they're going to have to make a decision on whether they wanted to apply the merger funding to that specific year. And if so, they're going to take one hell of a wallop in the last 2 or 3 years, and that's a choice they'll have to make. But having said that, I think what Chair Black has said and what Larry has said is that we are trying to the best of our ability to recommend something that everybody can live with. Bear in mind, there's going to be bottles of Bromo and Anacin going around to cover everybody. So it's not going to be the perfect solution, but it is the only solution right now that we can see makes sense.
Thank you, Sheriff Stewardship. I'll always love the Bromo reference. We should all have Bromo on hand. Yeah, no, I thank you for the first responses. So that's really kind of where we're at with it. Just to be clear on the mitigation funding, last year, we only billed the legacy funders, First Nations, and Peterborough County City. The amount less than mitigation funding, we took the mitigation funding ourselves. I'm proposing that we provide that mitigation funding, that $1,062,000 over the 2 years, back to the municipalities and First Nations that, and then they decide, as Cecil has said, as Councillor Ryle said, can decide whether you can put it all forward and your increase will be a cost of living increase or whatever the base budget increase is, or you could keep some of it back, take part of it forward, keep some of it back for year 3 and 4 and 5 to help again balance those budgets out for you. But that's a municipal and First Nation decision based on that. But that $1 million, municipality will pay the full amount, and then they'll be reimbursed the mitigation funding, and they can decide from a budget perspective how they want to manage that fund, put it in the reserve, put part of it in the reserve, whatever. So just to be clear, that's a little bit different than what happened last year. Okay, last year they only paid the cost of living budget increase, not there was some mitigation funding last year. Okay, questions? And Mayor Lowell, and then Councillor. Sorry, Wayne Clark second.
Thank you.
Yeah.
Thank you, Chair. First comment is when I was involved in this in the initial, we did talk about over 8 years, and that was just way too much.
Yeah.
So I'm happy to hear we're considering 5. My question is, because this is one-time funding that we're getting from the province, you really got to catch up, because that's not going to keep coming from year after year after year. So it's going to be pretty hard on Peterborough and the Peterborough legacy to pick up all of that, because they're going to have to pick that up themselves.
Yeah.
Correct.
Yeah, no, it's as I said when this item came forward, we understood based on the sensitive report that there was a difference in per capita funding, and for all the reasons different business, completely different territories. So we knew somewhat that would have to be equalized at some point. But again, I think as a board, as a separate board back then, legacy board, we felt even though it was going to cost us a little more, well, a lot more, $6 million over 5 years and then forever. It was worth it. It was worth it to serve the residents of the greater community. But we learned a lot through COVID that both health units struggled. We had to resource just about every human person breathing in the organization to COVID. And it forced us to get way behind on other critical programs that we needed resources for. So I think that was where our board came from with it. Again, recognizing we're going to have to pay more. We could have stayed the same and probably paid, we'd still have to pay more, I think, because we were a little short anyway, but it wouldn't be to this degree. So I think the 5 years is a balance. I know Legacy HKPR was 3 to 5 years. Legacy PBH was 5 to 8 years, and we met in the middle, and I think it's a good compromise. The front end loading gets us there a little bit quicker from a total budget perspective. So I think that's a good compromise there as well, as opposed to spreading it out over 5 years. We're doing 70% of it in the first 2 years, and then 10 and 10 and 10, as Larry has said. So I think there's been a lot of good conversation, a lot of good compromise at stewardship around that, and that's the recommendation at this point.
Can I have one follow-up?
Yeah, one follow-up.
And I'm speaking on behalf of Northumberland County now. 5%, we're looking at our budgets and we're having a difficult time keeping at 5%.
Yeah.
And I'm sure everybody else is in the same boat, but it's going to be difficult. So
yeah.
I think we got to be sharpening our pencils even at 5%.
Yeah, so again, the information that came on this particular issue that really deals with strictly harmonization. That 5% was a placeholder. It just so legacy HKPR people are actually saying that they're getting an increase of some sort in the math, right? So that was just for the math. That's a budget issue that we're going to be talking about later in the month and bringing forward to the October board. So it may be 5, it may be less, it may be more. We don't know at this point. So we haven't got an answer on that. I'm going to go to Warden Clark.
Thank you. Yeah, thank you, Ron. And through, I appreciate first of all, the hard work that the Stewardship Committee, and certainly looking at this as a compromise. We all hate going through the budget process, but this certainly, with the funding coming directly, then the municipalities then can choose where to put that funding accordingly. So I think this is a fair compromise. I certainly can support the recommendation that the Stewardship Committee has put forward, and certainly think that it will fly much better than the other scenarios that were present there. So thank you for all the hard work, and I full support on going with the 5-year. Thank you.
Thank you, Warden Clark. Any other comments, Mr. Marshall?
Yes, through you, Chair.
Yeah.
Just a question. So the 26 legacy PPH contribution was about 4.1 million. And the 27 contributions for legacy PPH was about 4.8 million. But does that include the 1,062,000 merger funding, or is it not reflected in those figures?
The increase reflects the total amount. It doesn't reflect the mitigation.
Okay, so it actually for 26, 27, it's a total of, 8 to 9, almost 9 million. It's going to be actually less. It's going to be 8. A contribution.
They will still be levied that amount, but then they will receive the mitigation.
And that's back from what was.
Yes.
Yeah, okay, so it's actually, these numbers are less than.
Yeah. Any other, Councillor Joyce?
Yes, thank you, Chair. Just a couple questions here. I'm trying to wrap my head around the numbers that you're throwing around. So I'm looking at the 5-year plan. 5% for Northumberland, CTL, Haliburton, and around 20-21% for the other regions. Is that what's paying your taxpayer? Does that include this mitigation funding? So what's the real increase?
Yeah, so the 20.7 for Peterborough City includes the 5.
Yeah.
So the delta is 15.7% on top of, right?
But of that 15%, is that including the mitigation that you're getting back?
Yeah, go ahead. Yeah. Yeah. There's a lot of numbers. I worked all weekend on trying to make sure we can get.
I'm not going to use numbers. I'm going to use simple description, and then please feel free to elaborate if you want more details. So first of all, we knew this was going to be a problem. It was a challenging, conflictual problem between both boards prior to the merger. And I think my congratulations to Stewardship to finally have a recommendation on this. That's been 2 years of, I think, very thoughtful, hard work conversations. So big congratulations to the chair of Stewardship, Cecil, because I think that is important. The proposal they have is in essence that annual budgeting is an annual process, and you'll see the annual budget in October. So that hasn't been approved yet. The anticipation that the penciled in number was 5% for that. So pocket of increase number one, 5% increase to all local funders in a uniform way. Pocket of funding number two is harmonization, and that's going to happen over 5 years, but front loaded such that years 1 and 2 are larger. So 2 increases, and the return dollars, what we're calling mitigation, is for pocket of funding number 2, which is the harmonization increase. Yeah. And those are only available until March 31st, 2027. And in the business case, we actually budgeted the full amount. So had we harmonized on day one, we budgeted that, but we didn't implement that in year 1. We're looking at a partial implementation year 2 and then year 3. But the proposal here, I think, balances as much of an increase as possible with returning as much, provincially supported dollars as possible.
Right. So
just trying a different
15% extra increase that Peterborough residents are going to be hit with, they're actually going to get a refund
to the municipality, and this is where the conversation Cecil had.
It's not really a 15% increase because you're going to get the mitigation dollars.
Well, and they can choose. They can choose, and in the past, one of the funders had chosen to put that into reserve when a similar issue happened around the context of a funding formula change several years ago. So to buffer it over the full 5 years.
Yeah, but it answers the question.
Yeah,
it reduces that impact.
Yeah.
Okay.
Yeah. The difference is though, the base becomes a new number the next year. Right. So now they are paying that difference in year 2.
Okay.
Plus the mitigation funding.
Yeah.
So it keeps bouncing forward. So after the first year, you're right. Yeah. But after that, the base funding amount, that 15% additional in year 2 goes on top of the new number. And so they have to cover that new number, right? So just to be clear. Yeah.
Okay. Yeah. No, thank you. The mitigation funding, Northumberland, CKL, and Haliburton are not benefiting from that.
Yeah.
Are there rules around that? We can't benefit from it. That's what I thought.
So legislatively, we as the board at some point have to come to an agreement for capita funding.
Yeah.
And you're already hired, so mitigation funding is there. It was 1.5 million in total.
Rules about how we can use that funding.
Yeah.
Okay. My last thing is the comment. I would have liked to see it certain. Yeah, we have compassion for sure. 1 and 2 year, I'd say out here. If I was on the other side, I'd be on multi too. I think that's just this nuts. But I would have liked to see a 3 and a 4 year chart. Just to see it.
So at committee stewardship, Cecil and I, we didn't have 3, 5, and 8 that we reviewed. We didn't have 4, or we had 3, 5, and 8 to look
at. 3 year then. It's not in here.
C and D are in there.
Yes.
Yeah, trying to do that. Yeah. You get 1 year, 2 year.
The thing too that we wanted to do, the thing that we want to make sure, up here, there are other people on the stewardship committee here that can sort of validate. It gets to be complicated when you start doing the mathematics in a prorated way. What we wanted to do is have a simple invoice, case closed. Here is your invoice, and here is your rebate. There's 2 separate numbers. One is an invoice that you pay a check to. The other one is a rebate you're going to get a check from. So at the end of the day, now you get a check for whatever that rebate happens to be. When you get that rebate, you have a choice. You can put it all on your merger, your levy. You can put none of it on your levy. One way or the other, that's the bill you have to pay. And it's now going to be brought into a situation where it's the end of a 5-year period, because we realized in the first year, we just kind of sort of made sure the gap didn't get any bigger. So it's really a 6-year program. If you look at the fact that the first year, we chose not to make it grow. So at the end of the day, there's no confusion. This is what you need to pay. And here is the rebate that you will receive, to which you can now do what you wish with the rebate. You can either, you want to fix a road with it, that's your choice.
Yeah.
But at the end of the day, the bill for the health unit is this number.
I understand the
Right. Thank you. One more question. We're running very tight on time, Mr. Marshall.
Yeah, I think we all understand what you're saying. So the question, I think that the HKNP PR people are interested in is that that money could be used however you want. But it's still your money and you can offset the cost of the increase. It's something that by using that money if you choose to. So it's still, it doesn't impact the figures that we're looking at by, as well, we mentioned, by the $1 million. The second question I had is, if I'm correct, the total merger levy provincial money is 1.4 million.
1.476 or something like that.
Okay, whatever, 1.5, let's say. And we're only going to be using $1,062,000.
Yeah.
So I know you mentioned this in the beginning, but I didn't quite follow what happened to the $500,000.
Yeah, so that additional 400,000 and whatever it is, it would add over $5 million to the PPHE base funding over 5 years.
Because of the increase that's
Because
required.
they're now moving,
As the base grows, it has to increase.
well, again, as I mentioned to Councillor Joyce, regardless of whether the mitigation funding comes in year one, year two is mitigation funding, and that's the base where it starts again in year two and year three. So if we move to the highest per capita in year one,
Correct.
for the next 5 years and forever, it's that same amount each year. So
It's just that you catch up faster, right? The per capita levels will match
in
faster.
year one,
Will match faster
Yeah.
because you got an extra 400 and some $1,000 in there.
Yeah.
While it's more money to be paid.
Yeah.
I get that, but what we're trying to do is get the per capita numbers to be equal. We've done it here over 5 years.
Yeah.
And we can see what it looks like for 1 or 2. Certainly by putting that 400,000, whatever it is in there, we'll probably reach a per capita level of maybe a year earlier or.
it'll be in that year. It'll be a total for year one. If it's all paid in, then that'll be year one. It'll be equal in per capita. But again, like I said, that raises the total increase over the 5 years to 11 million from 6. So there's not a lot of value in taking that extra 300,000 or 400,000 for mitigation funding, because the tax increase for legacy PPH goes from 6 million to 11 million over that 5 years.
Okay.
Yeah.
I understand. We can't use that 400,000, whatever it is, for something else, like we're saying, as Cecil here says, we would say that we give the $1 million back to legacy PPH and they can use it for whatever they want.
Yeah.
That with this one.
No, and again, that was part of the proposal, it's part of the legislation that from the base budget has to be shared equally. And that the board has to come to an agreement on harmonization, and that's what this piece is about. Okay. I think Gordon Clark, and then we're gonna call for a vote.
Thank you, and I appreciate, Cecil, the way you explained it. That was a very, I always say, talking a grade 5 level and we'll understand. It was marvelous and clear. So I'm prepared to move the recommendation that it was proposed by the Stewardship Committee, and that is accepting the implementation of scenario 2B as presented in our report.
Thank you, Ward. Is there a seconder for that motion? And Kinsky, thank you. Any further discussion? All those in favor? Show of hands. Thank you. Okay, thank you. And again, I want to thank Cecil and committee. It's been a lot of hard work and a lot of compromise to get us here. And it's one last hurdle, I think, that we knew when we went into this, that hopefully we'll bring the board together moving forward, and we can now just work with regular budgets, and we've given staff direction on that piece of it. So going to move to 8 consent items. Is there anything that anybody wants to pull for consent items? So that includes a number of letters that have gone out and some policies for approval. Just a comment on the policies. Again, every meeting we're trying to merge together a number of policies. These ones deal typically with the medical officer health, the CEO policy and appraisal forms. There are changes coming to that, but again, so somewhat of a placeholder when we put these policies in place right now, because we have to have something. But again, they may change as we move forward, so. And the stewardship committee is the, June minutes, as part of the consent as well. Any discussion? Mr. Johnson?
His Excellency. Just a note, for everyone here, through the chair, there was a letter sent out about intimate partner violence. Has anybody actually read Bill 173 that was being proposed as the foundation for that letter?
I haven't read the bill, I can honestly say that, but.
It's 3 sentences, so it's unfortunate. I was expecting a lot more from them, for direction. Whereas it seemed like a real political move that was, an insult to women and anyone in a very hard, relationship. I expected a lot more from that, and I hope that we can stand behind, maybe some solid, recommendations. Because that bill was a farce. It has no recommendations. It just says, let's just call it an epidemic and go home. I found that insulting. So I hope we can stand behind something a little bit more solid, because that's no foundation for such an important concern.
Thanks, Mr. Johnson. No, I don't disagree. I think it's upon all of us to do things locally on these projects. You can't depend on higher tier governments to put the boots on the ground. Gotta happen locally. So appreciate your comments to the board tonight. Anything else that anybody wants to hold?
For you, Mr. Chair, on the issue of medical officer, health executive officer policy, all the 8.2 A, B, C, D, created by drafts. Is that what you were mentioning, that this is going to be reviewed again at a later date? And is it going to be reviewed like by some human resources expert or legal expert, or who actually is going to review this?
Yeah, you go speak. Yeah, sure.
We had, so thank you through you, Chair. We had some conversation internally, and we're looking at the legacy policies. As you know, the board's trying to put in place all of the necessary policies it needs this year. And so this was sequenced for this meeting. We're looking internally at performance appraisal broadly for all of our organization. And so my suggestion is we approve these now so that we can do the performance appraisal on schedule and continue that, not have a gap while we're looking at that. But then I'd suggest, board reviews policies typically every 2 years anyway. So my suggestion would be either then or sooner that we look and ensure there's alignment with the new organizational approach with performance. But that we have something in place and not just wait for that work to be done before.
But do we have, sorry, complimentary, do we have a human resource expert? Like
we have a director of, we have a
human
people
resource
communications who's, so this is part of Matthew's work plan and strategy over the next year or so. And so I don't know if you want to add or speak to anything, Matthew, but my hope would be we'd make sure that mine's aligning with that once we have a new plan in place. But it's a little too early, but I still thought the board would want to have, because it's not just this, it's actually the MOH policy writ large, which would cover absences and recruitment and other things the board should have in place. And then at a PA level, I think it probably is worth reviewing it and making sure it aligns when that work's done. But does that make sense? Yeah.
Thank you.
Yeah, no, I think it's definitely changes coming forward. It's a matter of getting some base documents in place. Discussed with Dr. Tree a couple of issues that I would like to see change down the road, but I think at this point we need to move forward with getting something in place, and then we will bring those issues singly back to the board on how to change it. It's a very complicated appraisal process. There's like multi-pronged approaches. One's 2 years, one 4 years. So yeah, I think we'll get there. Any other items? Okay, can we get a motion to move the consent items as presented? Dr. Stelzer and Mr. Johnson, all those in favor? Some hands, thank you. We're going to move to, new business, in camera. Yeah, so we just need a motion. Yeah, so we need a motion to move in camera. Mayor Vogel and Councilor Chipka, all those in favor? That's carried. People to leave. Anybody leave? Take a minute? Yeah, take a minute.